7 minutes past 10 now. As I mentioned, I've got Dr. Matt Best in the studio. And we want to talk about heart disease, particularly in women, because every day 1 in 10 Australian women will die from a heart attack. And heart disease is now the biggest killer among women. And we often pass off some warning signs that something might be wrong. So we're going to talk more about that with Dr. Best. He's from Perth Cardiovascular Institute. He's also with the WA Heart Foundation. And I'll tell you about how you can raise some money for the Heart Foundation in a moment. But Dr. Best, welcome back to the studio.
Thank you, Nadia.
And he will take your call. So if you've got a question, 1300 222 720 is the number. Why is it so prevalent amongst women, and has that been a recent trend?
Oh, I think the prevalence has always been there, but the recognition and the understanding is something that we've been developing more over the last years. And I think women develop heart disease later in life, so they're sort of protected, in inverted commas, by about 10 years by having estrogen, but they still get it, and so that prevalence is still there. And they're much more likely to develop atypical symptoms of, coronary heart disease. If we're talking about blockages in arteries, it's the most common form of heart disease. But the prevalence of heart disease in women also includes things that, women, despite our progressive society, still have a pretty much a monopoly on, like pregnancy-related cardiac conditions. They pretty much own that space. And women are more likely to get some other uncommon conditions, such as that stress cardiomyopathy or Takotsubo's cardiomyopathy, and they're more likely to get this condition called spontaneous coronary artery dissection, where their arteries tear. So women have a few niches of cardiac disease where they beat men, but they still get boring old coronary artery disease like men do. They get it at a later stage in their life, but that prevalence is still there, and we're just getting better at recognising it.
What influence does the level of estrogen have as women get older?
Oh, I think that most of us see it as, in inverted commas, protective for heart disease, because the incidence of heart disease in women does go up a lot post-menopausal, and that's why their heart disease is delayed, and I'll get it at a later stage. I'm not particularly sure there's any particular level. It's just having active estrogen in the premenopausal state that's seen as somewhat protective.
And what about, warning signs? Because I read, and tell me if this is true, that they can often present differently in women than to men?
100%, yeah. They're much more likely to be atypical. The standard pattern of heart disease presenting is, an elephant sitting in your chest when you walk up a hill. And from personal experience with my sister, I know that this is not the way that they present. They present with much more subtle signs of blockages in their arteries. And so they can be harder to diagnose, and therefore their diagnosis can be delayed, and that's generally seen as bad.
What happened with your sister? What were her symptoms?
So my sister was working with some, buffed personal trainer that was mostly working on her arms because her hips were hurting. So every time she went to the gym, her shoulders were sore, and she was a 49-year-old female with not many risk factors. So, as her brother, I particularly blew off that symptom as well, and her GP wanted her to have a stress test. And I was thinking, oh God, stress test, come on, this is over the top. So lucky I managed to organise...
This coming from a cardiologist, people.
Completely blew it. That's why you never treat your relatives out.
Yeah, true, yes.
I was trying hard not to, but her GP was fantastic and organised a stress test. So she had it with our group one Wednesday a few years ago, and then I get a call from one of my colleagues, and she's had a cardiac arrest on our treadmill. And before you all panic there, stress tests are very, 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 very safe. It's very, very rare that this happens, but it had to be my sister, of course, who had basically a heart rhythm disturbance that pretty much made her heart stop, and she got zapped back to life. So that was a bad Wednesday for her, and somewhat for me.
My goodness me. She's all right now?
Yeah, she's fine now. She's done really well with treatment. But it goes to show, I guess the crux of that is not that stress tests are dangerous. The crux of it is that women can have atypical symptoms, and if they shouldn't blow them off, they should go and seek medical care.
Well, I want to bring Carolyn Visser into this. Carolyn and I will actually be walking together at 20Ks in a couple of months for Coastrek, and that's a wonderful event that's happening down in the southwest. Ultimately, we're raising money for the Heart Foundation. Carolyn, good morning to you. And you sort of had a similar experience because you had some warning signs that you also sort of passed off.
Exactly. Yes, I was trekking in New Zealand. I was doing the Abel Tasman walk with my family, having a wonderful time, and I just was breathless going up hills, and I was just so annoyed at my lack of fitness. I was like, why can't I get up this hill? It's just so agonizingly slow. I kept on passing off items out of my pack to my children because I was just holding everyone up. And I 100% thought it was a fitness issue, and that was actually my major sign.
So what did you do then? Because obviously, you know, how did you end up getting your heart checked?
Well, I did nothing because I never connected it to heart disease. It didn't even occur to me that it was heart disease. So I just changed GP, and she was very much into preventative medicine. She recommended that I was over 50 and I have a family history of heart disease, that I should have a comprehensive heart health check. She did some bloods, and blood tests found that I had an elevated cholesterol and my blood pressure was borderline. And she said, because of your family history, go ahead and get a calcium chest score scan, which, to be quite honest, I thought was a bit unnecessary. Why should I have a scan? So I went off and had that, cost me $180. And then, surprise, surprise, I get a text from her saying, come in as soon as possible. I thought, why? I feel fine. And she sat me down and she said, you have the highest calcium score of any patient I have ever had. And I was still confused. I said, what does that mean? And she showed me images of my arteries. You know, so your arteries are like totally blocked. And she must have seen that I was completely baffled. And she said, if you think of a scale of low risk to extreme risk, you are at the high end of extreme risk of having a heart attack anytime.
Goodness me. What was your calcium score?
2,581. Now, so one thing I've learned, if you're under 100, most doctors are okay with it. If you're up to, say, 400, they like to do some kind of intervention. But I was 2,581, and I had no idea.
So what happened? And we'll get Dr. Matthew Best to comment on this. What happened, Carolyn?
She referred me for the stress test, which I was very afraid to do because I was afraid to move. once I knew about the situation.
Course.
But I went and had it, and then I got a quick referral to a cardiologist who popped me in for an angiogram. He investigated it and found that I had a 7-centimeter blockage in the LAD artery, left anterior descending. And he said it was 90% blocked over 7 centimeters. So that meant I needed 2 stents inserted and medications after that procedure.
Wow. So that's a great story. So there's lots of really good things in there. I think the first thing is, over 45, you can go and get your heart health check, and that's what your GP did, and started picking up things like the blood pressure and the cholesterol and the family history. And that's really important because if you can document that a patient, one way or another, is at risk, either with risk factors or a calcium score, you can get them on really important medications. And as we've just said there, if the calcium score is over 400, we want to get them on cholesterol-lowering medications and probably aspirin as well. And that's what gives a lot of protection against sudden events. And don't worry, calcium score 2,500. I've seen 10,000.
Oh, gosh.
You know, you're not the worst. Not the worst.
I hope that makes you feel better, Carolyn.
Yeah.
Carolyn, does that make you feel better?
Oh, yeah, little.
Carolyn, I'll see in a couple of months on the 27th of October. You're walking Coastrek. You're one of the ambassadors. Just quickly tell us about Coastrek.
It's a fundraising event for the Heart Foundation, and we go in teams of 4. We trek either 20 kilometres or 35 kilometres down between Yallingup and Dunsborough, and we're raising money for this amazing cause to raise awareness. Now, I just think it's so important that we invest in this particular area of health because it's so subtle, particularly for women. You know, I never had a chest pain. I still don't know what heart pain is.
Yeah,
I have no idea.
Well, I look forward, Carolyn, to meeting you. I am an ambassador as well, which I'm very chuffed to be a part of. It's going to be a great event, but we